Welcome to Fox 8 News Now. I'm your host, Casey O'Day, and we have a fabulous show lined up for you today. Our guests are Dr. Zane Gates, co-founder with Donny Beaver, also a co-founder and CEO for Gloria Gates Care. Gentlemen, welcome to the show.
Hey, thanks for having us.
Thank you so much.
No, thank you. I've been admirers of your work for so long because you have been working to revolutionize healthcare and make it affordable and accessible for people in ways that others have never dreamed of. Do you want to get us started on that, Dr. Gates?
Well, you know, I've been doing this now for 24 years, and it all started with the free clinic that I started out of a van. Our chief operating officer says, "Oh, you can't tell that story." Well, I got to tell that story because it's so important. And then I realized over time how much cheaper it is just to take care of people. And that's when we developed our small little insurance plan that people could get for $99 a month, and worked with Van Altoona Hospital, and they would provide everything because we were keeping people out of the emergency room and keeping them out of the hospital, and it was a better way to manage them. And then I passed Senate Bill number 5 that would give hospitals funding to do these things in the community. And then, as typical with a lot of political things, the powers changed, and I moved on to doing something completely, that's my dream. This is the dream project that I've been working 24 years to go. Because me and Donny, who's just been a wonderful partner and a wonderful business mind, you know, we really want to change how people look at first people on Medicaid. Because everybody says, "Oh, there's people on Medicaid." No, 70 to 80% of them are all working, hardworking, honest people. I call them like the trees, right? We drive by them, we don't notice them, but they give us oxygen, they give us light. That wonderful bartender who, at the end of the day, you know, you had a bad day and and they're giving you a smiling face, or the person that's cleaning your hotel room. These people are enormously important.
Yes.
And they're the trees, and we just drive by them and ignore them, and they suffer in silence. And we believe that in some form of way we can cover anyone who doesn't have coverage, and give Medicaid patients and dual eligible Medicaid patients a place to go. We have a shortage of doctors in this area, and a lot of doctors can't afford to take Medicaid. We've designed a new model that allows us and take really good care of them, and it's a whole new, different kind of approach to healthcare that we're really both excited about.
I'm excited about it too. And Donny, what got you on board? What made you become a partner?
Well, it's actually, you know, it's interesting how pain points in your life drive you to solutions and find a better way. And we, as a family, had been through some really awful healthcare journeys that prematurely cost my wife her life. And
I'm so sorry.
Yeah, thank you. And just awful treatment, broken systems. You get a 30-page bill and you have no idea what it means, and how did you come up with these charges? And you know, it just seemed like the longer, and this had been over a 30-year period. This has been building up in the back of my mind. And plus, as a employer in the area, I bought a lot of healthcare through the years, and I paid a lot of money to buy it for hundreds and hundreds of employees. And it was like, why is this stuff going up at twice the rate of inflation? I couldn't figure that out. And so finally, after Pam passed, I became one of the primary caregivers of her mom, who lives across the street from me. And she got COVID, just about died. We willed her to live. And she actually had a very good healthcare experience, got out, went through the home nursing, got all better. And she decided to switch doctors because we heard really good news about Dr. Gates.
Everybody has good things to say about him.
And I've known his wife since she was little. She just grew down over the hill from me. So she went to see him, and she had an accident right in front of his office.
Oh my gosh.
Almost died.
On that note, I'm going to put you on pause because you're here for the whole entire show with us. And we'll continue that story. We're going to talk a little bit about your mom and about making your dream come true. All coming up next on Fox 8 News Now.
A lady that was her best friend and our very close friend to our family, when people would look at that lady, they would say, boy, look at her hair's greasy. She's, her clothes smell. She must be the scum of the earth.
We're back with Dr. Zane Gates and Donny Beaver, the founders of Gloria Gates Care. And before the break, Donny, you were telling us that your wife, or your mother-in-law, was going to his practice and had an accident?
Yeah, she had an accident, yes, at a light. And she was T-boned by a really big truck.
Oh my goodness.
And just, a double bleed on her brain. They had to drill all these holes in, and she was done. She was 89 years old. She didn't want to live anymore. She had just lost her daughter 9 months before. And it was just like, and we're trying to, is she going to get better, isn't she? And finally she just opted for comfort care, where they just give her a pain drip and don't feed her. And so, we were at peace with that, and she received wonderful care during that process. But then we had a vacation planned, and she just said, "Look, if you guys don't go, I'll haunt you all of your days." So we went on vacation while she's in intensive care. Felt terrible, and she said, "Look, just have me buried, and then we'll have a memorial service later." I mean, she's a very tough, practical woman, and so. And if you're watching this, Donna. And so I get a call on vacation. Hey, Mom woke up and she wants to eat. And within a month, she was moved from the hospital to a nursing facility and then assisted living across the street from Zane's office. So I get to wheel her across every couple of weeks to see the doc. And we start talking about his heart and how the system is broken, and how better care is available, especially on a preventive basis, and his desire to deliver not only to my mother-in-law, who could, she's on Medicare, she's not on Medicaid, but, and it was like, wow, so why isn't this business bigger? I think I said to you, right, Zane? And he said, well, there's a lot of reasons, and it's like, well, hey, if you ever decide you want to scale the business, let me know, because that's where I'm interested in, and you have the right heart. I think I bring a few skill sets to the game, and so that's how we got together.
I'm so happy to hear that you did, even though the circumstances were incredibly unfortunate, but something beautiful has come out of it. And you named this after your mom, Gloria Gates. I don't know her, only through your eyes, but some of the stories that you've told me about her have been so impactful. The story about your neighbor when you were growing up, do you mind sharing that?
Yeah, sure. Still, first to start talk about my mom had a very, very difficult life. And when we moved to Evergreen Manors, we didn't have any furniture, and she pulled our furniture out of a garbage can. And, she worked for the priest of St. Rose, and, went without food. And I used to watch her do all kind of things. But she taught me the lesson of the essence of what people really are. And a lady that was her best friend and our very close friend to our family, when people would look at that lady, they would say, boy, look at her hair's greasy. She's her clothes smell. She must be the scum of the earth. But what you didn't know is she didn't have any teeth because her husband beat her teeth out. And that her hair was greasy because any hair care products she gave to her children. And her clothes smelled because you had to pay for your clothing to be done. She raised two kids. The one went to college and one did very well, despite living with an abusive husband. And my mom taught me she loved her more than anything. And what I believe is all the people that people think are nothing have to be enormously special. And this is what my mom taught me, because someone loves them so deeply. And they deserve to get the kind of care as we all get. And my mom died because she had the wrong medical card and smoked a pack of cigarettes a day.
Okay, that contributed, but still.
Yeah, she didn't get TPA, which was standard when she had her heart attack. And this has fueled what she always dreamed about, because she was a pillar in our community.
And you are making those dreams come true. And we're going to talk a little bit more about this dream come true with the Gloria Gates Care coming up next. I'm so happy that you gentlemen are here with us today.
Thank you.
Thank you.
We'll be back with more coming up next on Fox 8 News Now. Welcome back. It's Hometown Retirement Specialist Money Monday on Fox 8 News Now. Our guests are Dr. Zane Gates and Donny Beaver, the co-founders of Gloria Gates Care. And we want to talk a little bit today about how people can support Gloria Gates Care. But now that this is a dream come true, what can people expect from Gloria Gates Care?
Well, I wrote a paper after studying the hospital system called Lessons Learned from Game Theory about healthcare price inflation. And it proved to me that if you took all the services that were people most likely to use and you put it into one place, you could do healthcare, 50, 60% cheaper than you could do it anywhere else. So that's exactly what we did. The first thing I did was subcontracted out with like the 611 and we paid them PM. But now at Puritan Place, behind the old, I call it Mercy Hospital, but now it's
Greystone.
Yeah, Greystone.
Yeah, Greystone in
now
Altoona.
it's Greystone. We will have a complete outpatient center. When you come to our place, the people that will see you, the providers, they can spend a lot more time with you because there's no involvement in insurance, no prior auths. We have contracts with the health plans that, pay us, and we can deliver the services. We have a pharmacist, you have your own dietitian. All the labs are done there, all of them. We'll have all the cardiology testing, like commonly used echoes, all the radiology, CAT scans, MRIs, physical therapy, psych that's integrated into primary care. We have such psych problems because we separate them. And most psych is done in the primary care office. So we'll have counselors and use telepsychiatry for medication adjustment. We will be a one-stop stop. But the thing that's even bigger is in the lower income people, the Oregon study, which was powerful, it says all the stuff I just talked about really only affects 30 to 40% of their health. What really affects their health is attacking the social determinants of health. That is, do they have safe housing? Do they have food? Do they have financial education? Do they have transportation? That Oregon study, which was so powerful, that has to be incorporated. And I'll give you one statistic that's enormously important. If you look at Western Pennsylvania, particularly in Pittsburgh, the average lifespan of a poor African American is 67. The average lifespan of a Caucasian, 70. The average lifespan of a middle class in that area is 78, and wealthy 83 to 84. Oh. If you can simply just take that person, forget all the CAT scans and the MRIs we do, they absolutely, but you can take that person and take them from being poor and giving them the tools to become middle class, you have increased their lifespan by 11 years doing nothing else.
And the quality of their life, period,
right.
Taking them on a better path. Donny, hearing a doctor talk like this
right.
has got to be inspiring.
Well, it's exciting. It's exciting for me because the way I'm able to help support this is now that I know I'm not a doctor, but I did stay at a Holiday Inn Express last night. But I can wrap my arms around how can I help you in job training? How can I get you a better education? How can I help you do better financial planning? How can I help you with your car, getting it fixed? How can I help you if you don't have a car? How can I actually pick you up like a cross between Lyft and Enterprise? And so I'm sort of bringing those things to the table, and we're baking all that in. So about 80% of what we're delivering has nothing to do with looking down your throat or in your heart.
Because you got to have them both.
You got to have both.
You do. And I know this is an overused phrase, but this feels like a paradigm shift when it comes to healthcare and well-being and just overall holistic care. Everything combined is the way it should be.
It's the primary care physician should be the quarterback of your health, and then all these other services, we take the cue off the quarterback, we run the patterns that he wants us to run, touchdown.
touchdown. It's awesome.
You know, like the biggest thing that I learned from...
I'm going to make you hold on to that biggest thing for 1 second. Okay, we're going to take a little break, and then we'll be right back to finish up talking about Gloria Gates Care. Thank you, gentlemen.
You're welcome.
We'll be back with more coming up next on Fox 8 News Now.
It shouldn't matter who you are, where you are. Healthcare should be the same product for the rich and the poor.
And we're back with Dr. Zane Gates and Donny Beaver, co-founders of Gloria Gates Care. And we left off with the biggest thing that you have learned, Dr. Gates.
The biggest thing I've learned, and has been my dream since I've come to this community, is to have everyone in Blair County covered with healthcare. And there is so many programs through Medicaid, then extension of Medicaid, and exchange insurance that will cover everyone. So our goal is phasing. Phase one is we're going to get everybody who's on Medicaid. If they don't have a doctor or a place to go, come to us. We're going to take really good care of you and give you all the services. Phase two then is going after, if you're uninsured or uncovered, we have ways. People don't know that, you know, if you can make up to $36,000 a year, if you have less than $10,000 of assets and qualify for Medicaid, exchange insurance, you know, you can get in Blair County, you can get a UPMC plan or a Geisinger plan that are really cheap, and you'll have all our services with it. We want our goal is to make sure that nobody goes without. And if you do have Medicaid, we're going to give you the experience that you deserve to get. My biggest thing is, think about the homeless guy drinking a Pepsi, right?
Yep.
He's drinking the same Pepsi as that rich guy living in the hills, the same quality of product. That's what we believe strong. It shouldn't matter who you are, where you are. Healthcare should be the same product for the rich and the poor. And the problem is with the model I designed, is we changed the financial model so that it's the exact same product. If the CEO comes to our office, he gets the same treatment as the homeless guy. You don't have to go, well, you have this card, you do. Everybody gets the same. It strips you down into the core of essence of what healthcare from the originators of healthcare as we know it expected it to be. So that's where it's different. And I took an oath to do that. That's what makes us, you know, physicians a little bit different. If you take being a physician very seriously, that oath is above everything. And our oath is to do no harm and to protect people from the illnesses that could take them away from their loved ones. And I know all of us feel the same. They're caught in the shackles of the insurance and all the administration, and what is lost is what we all as physicians really love to do, and providers, nurse practitioners, and PAs and pharmacists, is to really take care of people and make their lives better.
You're right about the shackle. We're not here to shame any other doctors by any means.
No,
they are
they're
doing
awesome. They're just if you ask them, I feel sad. I mean, I lived in that world, and it can't be done the way that the system's set up now. Doctors need to have all the administration out of their way, and they need to be able just to develop the relationship that is medicine.
And just to reinforce, right now, we're trending on $4 trillion a year in healthcare spending, double what any other developed country in the world spends per capita. We're spending $12,900 per person per year on healthcare. That's double the worldwide average of the 12 most developed countries. And what Dr. Gates has been able to do, most of our costs, a third of those costs, $1.4 trillion a year. Now you can't wrap your head around it. It's the size of the entire automotive industry is on wasted administrative. It's not paperwork anymore. It's electronic work. Denials, claims, fighting. I want to charge you this much. I'm not going to pay you that much. He's designed a system that's eliminated that.
And it's beautiful. And I admire, I've been admiring your work for many, many years, because I just don't like that disparity in healthcare. It shouldn't be that way. Where can people go? Is there, so we only have a few moments left, but is there somewhere online that people can go?
So www.ggcares.com, ggcares.com, or they could call us at 814-300-7777.
Thank you so much for sharing with us today. It's been a pleasure. You'll have to come visit us again. I could talk to you gentlemen for hours.
We could talk to you for hours too.
Thank you. It has just been
Thanks,
such a
Casey.
pleasure.
Thanks for having us.
appreciate it.
That's all the time we have for today. Thank you so much for joining us. We appreciate you too. Remember, you can join me weekday mornings on Wally 100, weekday afternoons on Key 96.5, and we leave you with our fan feature. Take care.